Okay, so today I'm going to be demonstrating how to give a medication through an enteral tube, feeding tube, or a nasogastric tube dissection. So the first thing I'm going to do is I'm going to go to the computer, I'm going to pull up the patient's MAR, and I'm going to pull up their doctor's orders for the medication. And I'm going to compare the two, make sure that they're congruent, make sure that it makes sense, of course, and then I'm going to go ahead and look and see what medication is ordered at this time. So right now we have ordered Lasix 10 milligrams per milliliter. So I see that on the MAR, so I'm going to pull it from my medication holder. I'm going to get it out. I'm going to say, okay, yes, this is the right patient. Yes, this is the right medication, right dose, right time. I'm going to confirm all the 6 rights. I'm also going to check the expiration date on this medication, and it has not expired yet. I'm also going to look up some history about the medication, look up to see if it can be crushed, which it can be, so that's good. I'm also going to look up some information about the medication, like side effects and the use of it for this patient. That way I can tell the patient what it's for. So, yes, I've checked, this is correct, and I know all this history. I'm also going to check the patient's history and make sure there's no medications that are contraindicated, that makes this contraindicated. I'm going to see if they have an enteral feeding going right now, and if they do, I'm going to know I have to go clamp it for 30 minutes before I give this medication. So I'm going to look at all their history, that way I know all the information that I need to give this. So after I've got all my supplies gathered, I'm going to need an irrigation thing, and I'm going to need a pill crusher, I'm going to need a cup, of course I'm going to need some water, I'm going to need the medication, so I'm going to gather all my supplies and get ready to go to the room. However, like I said, if there's a feeding, I'm going to go ahead and go to the room, and I'm going to check their name and date of birth and everything. I'm going to go ahead and clamp their feeding for 30 minutes, and I'm going to come back with this medication. So say I've already got the feeding clamped and yada yada yada. So I'm going to go ahead and get my supplies, head to the room, knock knock knock. Hi, my name's Dusty, I'm going to be your student nurse today. Can I get your name and date of birth? Thank you. And do you have any allergies that I need to be aware of? No? Okay, and are you in any pain right now? No? Okay, great. Well, I'm here to go ahead and give you your Lasix. Lasix is for your hypertension. What it's going to do is it's going to help to lower your blood pressure. Some side effects you might experience, it's probably going to make you pee a lot. You might get some dizziness, some blurred vision, those types of things. So if you have any adverse reactions, just go ahead and hit the call light and let me know, or let your doctor know whenever you go home if that's a problem. So I'm going to go ahead and perform hand hygiene and get my gloves on. I'm going to go ahead and, since they were on a feeding tube, they should still be in high Fowler's position. If they are on suction, I should go ahead and make sure they're in high Fowler's position as well before I give this medication. With suction, I would just go ahead and stop the suction and give the medication, and then I'll leave the suction off for 30 minutes. But since this is a feeding tube, I'm going to go ahead and prepare to give this medication like it's a feeding tube. So for the third time, or for the second time, I'm going to go ahead and make sure with the MAR, yes, Lasix is the right patient, right medication, right route, right dose, all of those types of things. And I'm going to go ahead and get one out. I'm going to set this aside. And I'm going to go ahead and crush this. Checking for the last time, yes, it can be crushed. Okay. Alrighty, and then before I'm going to administer this medication, since this is a feeding tube, I need to go ahead and check gastric residual volume. So I'm going to take this, I'm going to go ahead and unclamp this from the feeding. I'm going to check residual volume. If it is more than 200 milliliters, I'm going to return the 200 milliliters, and I'm going to waste the other. If it's over 500 milliliters, that's something I'm going to have to report to the doctor. So if it's under 200 milliliters, I can just return it all. And something that I will want to have made sure is that this tube is placed correctly. If they're on a feeding, it should be placed correctly, but that's something that I would definitely check before I do anything with it. Okay, so I've already checked gastric residual volume. I'm going to go ahead and flush with 30 milliliters of my water. Okay, I'm going to clamp and mix my medication with about 10 milliliters. Should be enough. sure it's mixed up really well. Sometimes you need slightly warm water to get some medications mixed up. I'm going to go ahead and draw it up with my syringe. And I'm going to go ahead and unclamp, and I'm going to go ahead and administer it. I'm going to reclamp it. And I'm going to take 30 more milliliters to irrigate it with. I'm going to irrigate it with 30 more milliliters there at the end. And I'm going to go ahead and clamp it back and undo my syringe. And then at this point, I'm going to go ahead and take my gloves off and document my administration. I'm going to tell my patient if they have any side effects to let me know. Whenever I'm documenting, I'm going to document, of course, the medication, the route, any complications. I'm also going to document the residual volume and all of that. And finally, I'm going to document on the I&O how much I put in. That way I know whenever things are coming out, how much I put in, of course. And then if it's a feeding tube, like I said, I'm going to go ahead and leave the room and come back in 30 minutes to hook that feeding tube back up. If it's suction, I'm going to do the same thing. I'm going to keep it clamped and keep the suction off for 30 more minutes at least. That way it can get absorbed. And so after I've documented everything and I've performed hand hygiene, I'm going to tell the patient if they need anything, here's your call light, let me know. Okay, so I'm going to be demonstrating the insertion of an NG tube. So the first thing I'm going to do is I'm going to want to make sure that this is a patient that needs an NG tube. So I'm going to check their orders and make sure, yes, the doctor has ordered an NG tube. So after I've done that, I'm going to go ahead and maybe check their history, see if they've ever had one before, if they've ever experienced it, so that I can kind of judge the teaching that I need to do about it. So then I'm going to go ahead and get my supplies together. I'm going to need my tube, I'm going to need my little valve, and I'm going to need all of the suction equipment. I'm going to need some lubricant, I'm going to need some tape, I'm going to need a checks pad. I'm also going to need a syringe and my stethoscope. And I'm also going to need a cup and a straw so they can take drinks. And then I'm going to need a little clothespin and a rubber band. So after I've gathered all my supplies, I'm going to go ahead and head to the room with them. So here we go. Knock, knock, knock. Hi, my name's Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Thank you. Do you have any allergies that I need to be aware of? Okay, and are you in any pain right now? Okay. Well, I'm here today because the doctor has ordered for me to give you an NG tube. So what that is it's a nasogastric tube. It goes through your nose and into your stomach. And the purpose of this is, you know, you've been experiencing a lot of nausea and vomiting, or you just need some decompression for other reasons. So depending on the patient, I'm going to explain to them what the reason why they need this tube. I'm going to ask them if they need any questions. I'm going to go ahead and kind of go through the procedure with them. I'm going to tell them that what we do is we take the tube and we insert it through the nose, and then we have them swallow, swallow, swallow until it gets all the way to the belly. And I'm going to tell them it's going to be hooked up to suction. So if they don't have any questions, I'm going to go ahead and prepare. First thing I'm going to do is I'm going to go ahead and hook up my suction equipment. So I got my little I'm going to go ahead and check this, make sure it's suctioning, turn it on, make sure it's suctioning. I'm going to go ahead and put this on, make sure it's suctioning. I'm going to go ahead and connect this.
Are you it, Tyler?
Make sure it's suctioning. And I'm going to go ahead and connect this tube and make sure it's suctioning as well.
Do you mind to talk out here?
Okay, and everything's good. I'm going to go ahead and turn it off. Set that aside. And then I'm going to go ahead and get my supplies ready. I'm going to go ahead and perform hand hygiene and put some gloves on.
Okay. I just want to be here for the lady who's talking about Mercy.
Okay, I promise I won't.
Okay.
Okay. And I'm going to go ahead and have a basin around as well because, of course, this stimulates the gag reflex and I might puke.
I thought you were leaving.
So after I perform hand hygiene, got my gloves on, I'm going to go ahead and raise the bed. Still working right.
Okay.
Oh, yeah. Okay. Yeah.
Okay. Alrighty, I'm going to go ahead and make sure the patient's sitting up in bed really good and high. Okay. If they're able to take the cup, I'm going to go ahead and have them take the cup with water so they know that they're going to be taking drinks out of it. I might go ahead and have them take a couple drinks and moisten their mucous membranes. Then I'm going to go ahead and get my checks pad. And go ahead and place it on them.
There's always at least one other for me.
Okay. Alright, now I've got my tube and I've already got my valve hooked up to it. Got my saline sump valve and my reflux valve. I've got my lubricant. I'm going to go ahead and get my tape ready. Okay, so after I've got my tape ready, I'm going to go ahead and assess my patient. Like I said, I'm going to go ahead and check their nostrils. I'm going to go ahead and make sure there's no perforations, no deviation, no polyps, no obstructions. I'm going to go ahead and have them blow their nose to see which nostril I'm going to choose. And I see that their left nostril is best. So I'm going to go ahead and listen to their bowel sounds real quick before I start this. Okay, and I hear that their bowel sounds are good in all 4 quadrants. Okay, so after I've listened to their bowel sounds and I've assessed all that I need to assess, I'm going to go ahead and prepare to insert this tube. So I'm going to first measure. I'm going to measure from their nose to their ear to their xiphoid process, so NEX. Okay, so I have about 52 centimeters. So I'm going to go ahead and tape that. I got my tape here. So I've already taped and marked where I need to insert it. Now I'm going to go ahead and get my lubrication and put it on my glove, really good, lots and lots of it. I'm going to go ahead and get this real lubricated. I don't want to use this sparingly. I want to get lots on there because it's an uncomfortable procedure for the patient. So now that I've got it ready, I'm going to go ahead and tell them that I'm going to go ahead and start inserting it. I'm going to have them get their cup of water, and they're going to take drinks whenever it's time. So I'm going to tell them the first thing I want them to do is I want them to kind of tilt their head back just a little bit, just slightly. And I'm going to tell them that whenever I feel resistance, I'm going to have them tuck and swallow. So I'm going to have them demonstrate tucking and swallowing for me. That way I make sure that they understand the procedure. So after they've done that, I'm going to say, okay, I'm going to start. Just go ahead and take a deep breath for me. In, out, and then in and hold it. I'm going to go ahead and start inserting. Okay, and I feel resistance, so go ahead and tuck your head and swallow for me. They're going to have this up here. Swallow, swallow, swallow. Okay, now I've reached the tape. Okay, so if they were to cough or gag, I would stop inserting lightly until they stopped coughing, and then I'd go ahead and have them swallow and everything. So I'd also have that basin ready if they were puking. Okay, so I've reached the tape. I'm going to go ahead and tape it on good.
You heard me.
Okay. Something that I would have wanted to do before I inserted this, I would have wanted to wash their nose off, get all that oil, any secretions off, so that's something good to remember. So now that I've got it inserted, I'm going to go ahead and get my tube ready. I'm going to get the suction on, turn it on, I'm going to put it right by the bed, and I'm going to grab a syringe, and I'm going to go ahead and get some air in it, and this is to make sure that it's placed correctly. Of course, I'm going to want to get an x-ray before I put anything into this tube, but since I'm only going to be taking air out of it, I can go ahead and check placement this way. I'm going to go ahead and hook this up with air. I'm going to go ahead and put take my stethoscope. I'm going to put it on their belly. I'm going to be listening to their belly while I do this, listening for bubbles, and okay, I hear bubbles. Great. It's placed correctly. I can go ahead and hook up my suction immediately. Alrighty, so after that, I'm going to go ahead and get my pin and my rubber band. And I'm going to I'm going to go ahead and take that, get it onto their gowns. I'm going to put the rubber band around it and take this and pin it onto their gown. And I'm going to go ahead and clean up my work area. I'm going to go ahead and document my insertion. I'm going to document the nair, the size of the tube, the time, all that stuff. And then I'm going to go ahead and start my INO measurement. So of course, the secretions that come out of here, I'm going to go ahead and put a mark on this basin right here. I'm going to mark each shift with the time, my date, my name, and the date. And after I've done all this, I'm going to go ahead and take my gloves off, perform hand hygiene, and document everything. And then I'm going to let them know if they have any problems, just give me a holler, and I'm going to come back and check on them soon. Okay, so now I'm going to demonstrate the removal of an NG tube. So the first thing I want to do is I want to make sure that this patient's NG tube is supposed to be coming out. Usually the doctor will have us take suction off for a little while and go ahead and have them start like eating and stuff like that to make sure that they can handle the NG tube being taken out. And so this will probably be disconnected for a little while, but if not, after I've already confirmed that yes, I need to take the NG tube out of this patient, I can go ahead and come to the bedside, knock, knock, knock. Hi, my name's Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Thank you. And do you have any allergies or are you in any pain? No to both? Okay, great. I'm here to take out your NG tube. So this should it might just get a little uncomfortable coming out. What I'm going to have you do for this is I'm going to have you hold your breath while I take it out, okay? I'm going to make sure they don't have any questions. So I'm going to go ahead and unhook it from here and check one more time, make sure this patient's NG tube is supposed to be coming out. I'm going to go ahead and unhook it. I'm going to go ahead and I'm going to perform hand hygiene to put these gloves on, which I've already done. Hand hygiene, gloves on, and then I'm going to go ahead and unhook this. I'm going to go ahead and have a tissue for them, a tissue in their hand. That way they can blow their nose afterwards. Something else I'm going to want to have is I'm going to have their chucks pad underneath them. Alright, so I'm about to take it out. Okay, ready? I'm going to hold your breath, take a deep breath in, and hold it, and okay, and they have the tissue to go ahead and wipe their nose off and everything, and I'm going to go ahead and document the removal after I've done this. I can go ahead and put this in the document the removal. I'm going to document, make sure it came out in one piece, no problems, no complications. I'm going to go ahead and take my gloves off, perform hand hygiene, ask them if they have any questions. If there's any bleeding or anything, I'm going to go ahead and make sure I tend to that. I'm going to go ahead and put them in a comfortable position. Make sure they don't have any questions for me. We'll let them know that I'll be back soon to check on them. I'm going to go ahead and clean up everything, probably get this out of the room and everything, and document my final output, and put the call light in reach and let them know to let me know if they have any questions.